let's talk about stopping a stroke before it even has a chance to strike. So, what if you could? We're going to look at a procedure that does exactly that. Think of your brain's fuel lines. Two major arteries in your neck deliver that essential fuel. But you know, gunk like fat and cholesterol can build up, creating a dangerous traffic jam. And here you can see it. That narrowing, called stenosis, happens right there in the neck. And that's a huge problem. It can starve the brain of blood or worse, cause a stroke. Now, this can go one of two ways. You either get warning signs or you feel totally fine. Okay, if any of these things are happening, the risk of a major stroke goes way, way up. So what's the fix? Well, there's a really smart, minimally invasive solution called stenting. It's basically a tiny metal tube. Its job? Prop that artery open and get the blood flowing again. So how does it work? It's actually a pretty straightforward three-step process. First up, a super thin tube is guided right to the blockage, usually from the wrist or leg. Then, a tiny balloon inflates. It expands the stent and squishes that plaque out of the way. And just like that, you've got a wide open highway for blood to get to the brain. But here's the big question. Does everyone with this narrowing actually need a stent? Well, that's up to the doctors. They'll look at these key things to make the call. Sometimes medication is enough, but for severe cases, stenting can dramatically lower that stroke risk. Okay, let's tackle a huge misconception that a lot of people have about this. A severe blockage is basically a ticking time bomb, whether you have symptoms or not. Getting a stent is a huge step, but it's not the end of the road. It's a lifelong commitment. To stay healthy, this is what you have to do. It's absolutely essential for the long haul. So, for family members, here's the deal. You have to be vigilant. You have to pay attention. Because at the end of the day, prevention has to start before the damage is done. That's key.